My name is Redmon, and today I will be informing you about my disease, Ebola. But before I begin, I would like to start off by telling you a true story about a guy named Thomas Duncan. Duncan had visited his family in Liberia, as he usually did. But little did he know that this would be the trip he would never forget. Duncan returned home to Dallas, Texas, and had noticed some peculiar things happening to his body. So then he immediately went to the doctor and was told he was diagnosed with Ebola. Hi, I'm Redmon, and today I will be presenting my disease, Ebola. So today we are going to go over Ebola's background, the history, the causes, the symptoms, the transmission, the diagnosis, the treatment, the prevention, the social effects, the experiment, my conclusion, and the interesting facts. Background. So what exactly is Ebola? Ebola is a viral hemorrhagic fever that is caused by a Ebola strand in your body, in your bloodstream. And a hemorrhagic fever is basically a multi-system syndrome that attacks your bloodstream and causes your body to bleed unexpectedly. And there are 5 types of Ebola. There's the most common one, which is the Ebola virus, and there are the other 4: the sudden virus, the typhus virus, the Bundy-Baggio virus, and the Redmon virus. History. Ebola's first outbreak occurred in 1976 in Zaire, Africa, which today is presently Democratic Republic of Congo. And Ebola was discovered by Peter Payet, a Belgian microbiologist, in 1976. The first epidemic infected over 280 individuals with a starting mortality rate of 53%, killing over half of Ebola's victims. Causes. Ebola is simply caused by a strand of the Ebola virus attacking your bloodstream. So it's also classified in the family Floridae type Ebola virus. And some of the symptoms of Ebola are usually the common flu-like symptoms, the common cold. So it results in fever, severe headaches, muscle pain, weakness, fatigue, diarrhea, vomiting, abdominal pain, and in severe cases, it can result in unexplained hemorrhage, which is when your body randomly starts bleeding unexpectedly. And the symptoms can occur from 2 to 21 days. Transmission. Ebola can be contracted through blood and bodily fluids such as urine, torn skin, sweat, saliva, breast milk, and semen. And also it can be transmitted through needles and syringes, contaminated needles and syringes, and also through anthropoids such as monkeys and apes and fruit bats. Diagnosis. So some diagnostic tests used to identify Ebola are the ELISA testing, the IgM antibody, ELISA testing, PCR, which is polymerase chain reaction, and virus isolation. Treatment. Presently, there are no FDA-approved particular treatments or prescriptions, but scientists are still conducting experiments and research to find a cure for Ebola. Prevention. Some factors of prevention are, in some of the severe cases, you can administer intravenous IV fluids, also stabilize electrolytes, or also control oxygen levels and blood pressure, and prescribe other viruses if they occur, because other viruses can impact Ebola even more if the viruses have some type of effect with the Ebola virus, and also simply quarantining victims of Ebola. Some social effects for Ebola is that because Ebola recently has had a tremendous outbreak in 2014 in West Africa, some healthcare individuals have experienced some hardships because a lot of people feel that their lives are in jeopardy, and they fear going to the hospital because Ebola could be there due to the use of contaminated needles and syringes. So the health workers are affected mentally, emotionally, and emotionally. And some residents in Africa also experience hardships and grief for Ebola because it originated there and predominantly resides in Africa. Experiment. For my experiment, the purpose was to use guinea pigs as a model to examine how individuals are affected by Ebola, and if they have Ebola, how they can adapt to it, and the harsh conditions, and presume a longer life than expected. The hypothesis for my experiment was if guinea pigs are used as a model for humans and non-human primates, then the guinea pigs will assist researchers on exploring the pathogenous Ebola virus, the hemorrhagic virus. Procedure. So the methods used for my experiment were basically the scientists retrieved the Ebola virus in the deceased patients that died from Ebola, and they injected it into the guinea pigs to see how they would react to the virus. And they examined their behavior and their appearance due to Ebola's reactions, and took observations on the recorded data. And the results for my experiment were that out of the 21 guinea pigs, 13 of the guinea pigs experienced fertility on day 7. And some of them generally stopped eating and became pyretic and desiccated on day 7 as well. And on day 9, most of the guinea pigs experienced death and was not accompanied by visible signs of hemorrhage, so they would just die without signs of bleeding on their body, which is not normal for Ebola, because usually patients die with loss of blood. In conclusion for my experiment, as a model, the scientists used guinea pigs for humans and non-humans successfully. So they were able to actually scrutinize the guinea pigs and actually look at the Ebola virus and the effects, so that other treatments and preventions can happen for Ebola. And also they were able to examine the pathological events in Ebola virus that led to the death of Ebola patients. And they also, for future applications, should probably use actual anthropoids and humans that die from Ebola to conduct this experiment. So, some interesting facts about Ebola is that the mortality rate is 70%. So more than 50% of Ebola patients die, so more than half of them die. So if you are able to contract Ebola, most likely you're going to die from it. And Ebola's name derived from the Ebola River in Zaire, Africa. And the largest Ebola outbreak happened in 2014, so last year, in West Africa. And it kills 90% of its victims. And the average death annually is 20,000 individuals. So I'm pretty sure you guys are all wondering about what happened to Duncan. Well, let's just say that unexpected trip costed him his life. Thank you. These are my citations. Any questions? Yes, Chris.
You said one of your the ways to transmit Ebola is like through bodily fluids. You said it was almost like semen. So could it be transmitted through intercourse?
Yes. That's how Duncan's wife got contracted with Ebola. Yes.
I want to know what the virus isolation was.
So it's basically when they take the virus under a microscope and they're able to isolate the actual virus and look at Ebola closely to see the morphology of it, to see if it's actually Ebola. Yes, Tammy?
What is the morphology of Ebola?
It's rod-shaped, so it's bacilli. Steven?
When do symptoms occur again?
2 to 21 days. Lexi?
Is Ebola gram-positive or gram-negative?
It's gram-positive. Taylor?
What is the mortality rate?
70%.
Okay, jazz hands.